What is up, guys? I'm William. Welcome to this episode of William for Acupuncture. If you're new here, then hi, I'm William, a master's student in acupuncture at the Beijing University of Chinese Medicine. Today, we are diving into one of the most famous acupuncture on this planet, Hegu. Whether you are from the east or the west, you've definitely heard of this point. But here's a fun twist. It's not so much about where Hegu is located, as it is about where the needle tip actually ends up. You might confidently point to the web between your thumb and the index finger, but if someone asks you exactly like how deep or at what angle to needle it, chances are you'd be a little bit stumped, right? And that's perfect normal. In fact, the true art of Hegu lies in tailoring the needle's placement based on the effect you are after. In acupuncture, the tissue layers you target can shift the effective location of the point. And today, Hegu is the perfect example of that dynamic principle. So before we jump into the different needling techniques, let's take a quick look at the anatomy of this area. Hegu is generally positioned near the second metacarpal bone, and understanding the surrounding structure is key. First up is the dorsal interosseous muscle. This muscle sits snugly between the metacarpal bones and is essential for spreading your fingers apart. Without it, your hand would be stuck in a permanent fist. Next, we have the adductor pollicis. As its name implies, this muscle brings your thumb toward your palm, enabling you to grasp and pinch. Both of these muscles play a critical role in hand movement and also influence the way we use Hegu for different therapeutic effects. And now let's break down the three primary techniques we use at the Hegu, each with its own distinct effect. First, we have the shallow needling. When the needle is inserted just beneath the skin, you will feel a sharp, almost stinging pain. This isn't meant to torture you. The area is rich in pain receptors and capillaries, so the initial sting is expected. What's happening here is that by provoking a controlled amount of pain, we trigger a sweating response. In traditional Chinese medicine, this sweat therapy helps expel pathogens by opening up the pores. It's a technique often used to kick-start your body's natural defense, especially during the early stage of an illness. Next, we move to a slightly deeper technique. In this approach, the needle is advanced until its tip resets on the fascia covering the dorsal interosseous muscle. At this step, the doctor adjusts the needle tip toward the upper arm and initiates a gentle vibration. With the right amount of time, patience, and intensity, many patients experience what is known as the meridian conduction sensation. A slow, diffused feeling that seems to travel along the energy pathway. It's that classic acupuncture moment when you sense a wave of energy moving away from the needle. Of course, not everyone experiences this, as it depends on both the practitioner's skills and the patient's individual responsiveness. Finally, we have deep needling. When the needle is inserted even further, its tip will eventually make contact with a second metacarpal bone. At this point, you will feel a deep, aching pain, courtesy of the periosteum, a sensitive, nerve-rich layer covering the bone. Although this pain is more pronounced, it isn't without purpose. The stimulation of the periosteum sends signals through nerves and blood vessels, which can be incredibly effective in treating various types of pain, such as headache, toothache, or even jaw pain. This deep approach is all about using the body's own pathway to transmit relief to areas that might seem far removed from the hand. So next time someone asks you, where exactly is Hegu? Tell me, where is that? don't just point to the general area. Instead, ask, what effect do you need? Because with acupuncture, it's not just about the acupoints location. It's about where the needle tips goes and what does for your body. Alright, that's it for today's episode. It's so quick, right? And if you enjoy this deep dive into Hegu and how its dynamic needling techniques can be tailored for different therapeutic outcomes, be sure to subscribe and hit that like button. I'm William, and welcome to William for Acupuncture. I can't wait to share more science-backed acupuncture insights with you in the next episode. Until then, stay balanced and keep exploring.